Last week, an earthquake shook the country's debate over health care. In his annual State of the State address, California Governor Arnold Schwarzenegger, who has long been a supporter of universal health care, announced that he could no longer put up with the corruption that has accompanied Obamacare. In his speech, Schwarzenegger said that the liberal push for health care reform has become a trough of bribes, deals, and loopholes. Governor Schwarzenegger is right, and his comments illustrate two important trends in the fight against a government takeover of health care. The first is that the public is waking up to the overwhelming corruption that has gone into writing this bill. Whether it was Senator Mary Landrieu of Louisiana proudly announcing on the Senate floor that her vote had been bought for $300 million, or Senator Ben Nelson from Nebraska getting his state permanently exempted from new Medicaid costs, some members of Congress are shamelessly cashing in at the public's expense. The second fact that is becoming clear is that state governments must not allow the feds to steamroll them. In Schwarzenegger's California, for example, the costs of the health care reform bill could add up to $4 billion to the state's Medicaid tab, money that California doesn't have. Even Tennessee Governor Phil Bredesen, a Democrat who used to be a health care executive, has called Obamacare the mother of all unfunded mandates. At a time of widespread economic turmoil, the states are in no position to pay the bills for a spendthrift federal government. Forcing increased deficits on already struggling states can but have one result: even greater tax increases at state levels. Currently, 27 states have taken legislative steps to oppose Obamacare. At the same time, 13 state attorneys general are questioning whether special favors like Senator Nelson's Cornhusker kickback are even constitutional. And throughout the nation, governors like Schwarzenegger are letting their opposition be heard. The liberals in Congress are trying to hoist health care on the American people as quickly as possible because they know they're running out of time. The loss of only one vote in the Senate could derail health care reform's chances of passage, and with the public overwhelmingly opposed to the plan, that is still a possibility. So, as we approach the final days of the health care debate, make sure that you do more than just call your members of Congress. Let your governor and state legislators know that they too must keep the government from meddling even more in health care. And they can remind Congress that not all power comes from Washington. That's this week's Freedom Minute.